Women have a strong presence in the field of medicine today. But when Dr. Susan Fisher-Hoch decided to pursue her career as a doctor, that wasn't the case.
When I went, only 15% of medical students could be women, and it took a lot of persistence and a lot of work to get in.
That pursuit of excellence has spanned Fisher-Hoch's 30-year career in virology and epidemiology, and it has included travels and investigations worldwide.
The first place I really worked seriously for long term was Sierra Leone in West Africa, and I loved Sierra Leone.
Fisher-Hoch worked tirelessly on learning more about Lassa fever and Ebola viruses and the use of ribavirin therapy.
I got into the viral hemorrhagic fever field and ended up working in Africa. And that was quite an interesting experience in terms of both epidemiology and medicine and infectious diseases.
A nearly decade-long career with the Centers for Disease Control and Prevention in Atlanta had Fisher-Hoch leading investigations into the Reston outbreak in the U.S., a Lassa fever outbreak in Nigeria, and Crimean Congo hemorrhagic fever threats in South Africa, Senegal, and Saudi Arabia.
One day I was sitting in my office there in Karachi, and somebody came in and said, "I want you to help me. I've got two of my cousins have come in from Balochistan, from Quetta." And I went to see them, and they were both surgeons. And they told this incredible story of the nomadic shepherd.
The surgeons operated for hours on him, thinking it was a GI bleed.
But he was just sort of oozing blood everywhere. And they were still operating till about 2 in the morning. And one of them said, yes, he definitely pricked himself.
2 or 3 days later, both surgeons became sick.
I received the infection just by pricking my fingers, and I was infected. And my friend also was infected by pricking his finger during surgery.
The body aches were so severe that I told one of my colleagues that this is not simple, but these are not the simple body aches. These are the aches of the death.
Fisher-Hoch diagnosed them with Congo hemorrhagic fever. She had to move quickly to find ribavirin to treat them.
And I knew it was a matter of hours, not days, that we needed to get it.
The medicine was found, and the surgeons recovered.
What is this child being treated for?
Fisher-Hoch has not only saved lives, but discovered countless medical breakthroughs. She played a central role in the discovery that the parvovirus B19 was responsible for Fifth's disease. She was also the designer of one of the most technologically advanced biosafety Level 4 labs in the world. It is located in Lyon, France. For that work, she received special recognition from President Jacques Chirac.
In public health, prevention is the name of the game, and prevention is the interesting alternative we have to ruining our country on health care. Because if we could save enough money by not getting sick, I think we'd be in better economic shape.
She continues to work on her prevention efforts at the University of Texas School of Public Health Brownsville Regional Campus, which is located on the Texas-Mexico border.
The opportunity of the regional campuses of the School of Public Health at the WITI Health Science Center was very exciting to us. We thought, oh, that's interesting, because we can combine now high technology and the population that most needs it. In South Texas, we've set up a program where we have a highly obese population with very high rates of diabetes, in whom we also have high rates of TB. And we've been showing that the diabetes actually damages the immune system.
She is also able to pass on her vast knowledge to up-and-coming researchers in her field.
Right now, it's bringing on the next generation of scientists, particularly women, who I can mentor and help to establish themselves.